早晨，大家好，歡迎大家嚟。
Good morning, everyone. Welcome to our ICON Health Forum, which is conducted in Cantonese. The topic is Stroke Smart.
First, we do lend acknowledgement. We want to say that UBC is located on the traditional, ancestral, and ceded territory of the Musqueam, and UBC operations are also on the territories of the Squamish and Tsleil-Waututh. We also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands.
我係何陳宇慈 Barbara Ho， 係一名註冊護士，亦都係安康健康網絡首席護理主任。今日咧，我係你大會嘅主持人。網上嘅朋友，大家好，歡迎大家嚟參加今日嘅安康線上中文講座嘅。呢個係誰有中風危機，應如何處理？
Now, simply put, I want to give you an introduction of ICON because some of you are first-timers. ICON is an initiative by the UBC Faculty of Medicine, the Digital Emergency Medicine, and the executive director is Kendall Ho. We've had this for 19 years. We also thank patients as partners, as our partners. We wanted to convey reliable and useful information to communities, to the indigenous citizens in BC, as well as family members as patients, provide them reliable and relevant health information on prevention and care of illnesses using technology so that they know how to manage, find technique to manage and lower the risks of having these illnesses. At the same time, we also will provide electronic apparatus, apps to the community to help them on improving health. So after a stroke, as I said, those two elderly gentlemen have experienced the recovery process. And today we have invited Dr. Richard Ho, who is a physiatrist or physical medicine and rehabilitation specialist. He completed his medical degree in UBC. His specialty is on exercise and sports injury and ultrasound, as well as muscle injection. Now, Dr. Ho is a new clinical doctor at UBC. In 2019, he received an award for being an excellent educator. Unfortunately, he's not able to give us his talk live today, but we have made a recording of his presentation, and through this presentation, I hope that you can understand what is rehabilitation after stroke and the timing, the scheduling, and what members are comprised in the rehab team and what their roles are in the rehab process, and see if the rehab process can help those patients who have had strokes. So let's hear from Dr. Ho. Thank you for inviting me to talk about rehabilitation after stroke. There are no disclosures today. After a stroke, the cells inside the brain have been affected. And since they have been injured, there are many kinds of impact. Now we have to look at which areas of the brain have been injured because different issues may occur. Now, what kind of impacts are there? Here we have many examples. After one stroke, another stroke may occur. And there can be issues with talking or speaking, or issues with not understanding what other people say. Urination and bowel movements may also be affected, meaning incontinence. Thinking may also be affected, and memory may become poor. There may be contractures in the joints. It can also affect moods. Swallowing may be an issue, and there may be drooping of the face. The nerve pain may affect the shoulders. The nerve pain may also affect one side of the body or the hands. Now, vision and hearing may also be affected. And there may be loss of sensation on one side of the body. You may feel weak when you try to walk, or balance may be affected. If it is a serious case of stroke, there may be seizures. In summary, stroke can cause a lot of impact. If a person has had a stroke, there are a number of goals in rehabilitation to help you. First, it can help you learn how to adapt to changes after a stroke, changes to your body. Second, it will, as much as possible, help you regain your ability to move. Third, it will help you with discharge from the hospital. For example, if some kind of renovation needs to be made after you return home, they will help you with that. In cases of serious stroke, where it is unsafe to go home, then you should consider a senior's home. Fourth, rehab can hopefully prevent complications. For example, it will help you prevent slips and falls if your legs are weak, or to prevent another stroke. Now, if the stroke is minor, hopefully the body itself can recover to its normal conditions before the stroke. For moderate or serious cases of strokes, the body may not recover to its normal conditions before the stroke. When you go to rehab, your rehab team first assess your situation and the impact before they find ways to help you recover your day-to-day life skills. In a lot of cases, even after rehab, a person may not recover 100% of the normal conditions before the stroke. For example, if the legs are weak or unable to walk after a stroke, physiotherapy can train you to regain your strength. But if it was a serious case of stroke and you cannot regain your strength, your team may find ways to help you move. For example, they may prescribe crutches or a walker for you. If these do not work, they may teach you how to use a wheelchair. Another example is if a stroke has impacted your talking or speech, you can see a speech language pathologist. Sometimes they can get you some exercise to train your mouth movements, and hopefully with practice can help you gain your speech. But in serious cases, and if the above do not resolve the issues, they may find ways to help you communicate. For example, they may give you a computer and you can write with the computer or draw to communicate. In Vancouver, there are two kinds of rehab programs. The first kind is outpatient rehab. After a stroke, if your team in the hospital consider that it is safe for you to go home, then you can have outpatient rehab. This means you live at home and you go to the rehab center every day for rehab. You go home at night for dinner and sleep. In more serious cases of stroke, and if your team in the hospital think that you cannot live at home, for example, if you cannot go to the bathroom by yourself, you will have to go to inpatient rehab, which means you actually live in the rehab center. In most minor cases of stroke, where there are not too many impacts or the impacts are not too bad, you can have outpatient rehab. For moderate cases of stroke, most of them will live in the rehab center. For very serious cases of stroke where there are multiple impacts, sometimes even rehab cannot help you. There is another example. If multiple impacts occur after a stroke, including impact on the memory, or when the memory is very poor, you may not be able to learn what your team teach you at the rehab center, learn the new skills. In those situations where you cannot go home and you cannot go to the rehab center, you may need 24/7 care. Then you may have to go to a senior's home. A rehab team is made up of a number of members. The most important person is you, yourself, because when you go to rehab, you have to try hard to learn and practice new skills. The second most important component is your family, because they can give you support. In the rehab center, there are many kinds of therapists. First, you have a doctor who is a physiatrist who can prescribe medications and to prevent another stroke, and if necessary, arrange a physical examination. Second, there is a nurse who provides care for you at the rehab center and help you practice your skills. There is also an occupational therapist who can help you recover skills in your arms and hands, as well as day-to-day life skills, including putting on clothes, eating, toileting, and bathing. They can also go to your home to assess whether changes are necessary to make life easier and safer. There is also a physiotherapist who helps you with your movements. For example, walking, or teach you how to use the wheelchair or your balance. There is also a speech-language pathologist, or SLP, who can help you regain your speech, reading out loud and swallowing. There is also a psychologist who can talk about your moods with you. There are other professionals, such as a social worker who can make arrangements for you to return home safely, or where you can go after you're discharged. In summary, your rehab team can help you regain your abilities to move as much as possible and prevent complications. A rehab team may find different ways to help you regain your day-to-day life skills. They will assess your situation and impact to find ways to help you. For example, if your balance is affected, they can find ways to prevent slips and falls. Or if your muscles are too tight, if there's spasticity, they will find ways to relax your muscles. They also teach you how to prevent another stroke, which means you have to follow the doctor's orders to take medications. Your team will also teach you how to make lifestyle changes. When you go to rehab, you have to work hard as well as try hard to control other risk factors of stroke. For example, diabetes, atrial fibrillation, high cholesterol, or high blood pressure. Also, try hard to change bad habits. For example, if you're a smoker, meaning smoking cigarettes, okay, you should quit smoking or reduce alcohol intake or try to control your weight as much as possible. Now, in these two slides, I have included some information on stroke. You can read for yourself. Thank you. Thank you. Bye.
Thank you, Dr. Ho. Thank you for your explanation on the rehabilitation team. The gist is the patient themselves are very important because a lot of stuff need to be repeated to relearn. So try your best and be patient to practice slowly. That's a very important point. Doctor also
here we have the ways to contact us icon. So if you have more questions, you can either send them by email at iconproject.org, icon.support@ubc.ca, or Facebook and other media. And we also want to thank the Ministry of Health, the BC Ministry of Health Patients as Partners Initiative for their continuing support. So after we have listened to the presentations, we have acquired a lot of knowledge about stroke. Stroke is preventable, it is recoverable, and it is curable. So now we have imparted knowledge in the community so that they can reduce the risk of suffering these critical illnesses. I hope that you can spread the information to other people, and you can also view these presentations again in future after they have been posted. So I hope you enjoy a healthy and happy life. Thank you. Bye-bye.